spoke of it. So this is the answer here. I think one of these is equal to high quality, cost effective, and patient-centered care. And as we know, on the last slide, is advocated by CMS and supported by OIG. How do you know that you are delivering high quality care to patients? Any idea? How do you know?
Patient feedback.
Good. How about the patients say, I just want this medication, and you know it's not good?
Oops. Happens.
You know, a lot of patients are shockers, medication shockers. Okay. What other idea? How do you know you are delivering high quality care to patients?
Hospital admissions,
What do you mean?
like how many patients are admitted to the hospital rather than being kept in the community.
So you mean more admission, the quality care is lower?
Yeah.
Okay, I think one of the point is like that. What else? For medical school, what do you learn in medical school? How to deliver high quality care. Any idea? You remember evidence-based? Okay, so we do remember evidence-based practice, right? Rendr utilize evidence-based, data-driven, and team-based approach to support providers and deliver high-quality care, healthcare to patients. That's how Rendr is different, is innovative and high-quality care delivering model. For example, depression is one of the underdiagnosed disease. As identified by CMS, 1 in 6 people nationwide has depression. Yet the diagnosis rate is only 7%. When does depression screening rate only 38% in early 2022, but increased to 78% after the initiative started in August 2023. And the positive rate went from 1% to 8%. So it's a little bit higher than the diagnosis rate, 7%. We are still need to do a better job. At the same time, okay, so when we diagnose depression, we all know the whole country, mental health is short of staff, short of psychiatrists, social worker, psychotherapists. It's just difficult to help patients to get treatment. Okay, that's why when the introduce psychiatric collaborative care program. So when we diagnose depression, we can introduce the patient to this program, and then we cooperate the patient's comprehensive mental health care into the primary care setting. So we can take care of our mental health patients in a timely manner. Data-driven approach. We do use a lot of data-driven approach. I think many years ago, decades ago, we only talk about evidence-based, right? But now we all talk about data-driven. How to get the data, how to use the data to help us to improve our practice. With assessments from clinical, analytic, and operational teams, Rendr targets gaps in various types of patient care and support clinical operation. That's how we can receive 4.5 star quality rating in the past 3 years. And also we achieved NCQA recognition for delivering high quality diabetes care last year. And as the team approach and data-driven approach, we reduce the wait time and accommodate acute patient needs. And we scale the best practice. Any questions so far? Clear? Okay. So also, I mentioned about the evidence-based approach, data-driven approach, and now is team-based approach. It's good to do everything by yourself, right? Everything under your control. But sometimes we have to think our limitation. So teamwork is always better than work by yourself. By sharing responsibilities and leveraging the expertise of care coordination teams, physicians can reduce their workload and delegate tasks more effectively. When the centralized administrative teams increase compliance and further reduce the provider's burden on codings and billings and HR, etc. So basically, Rendr's innovative value-based care focus on 3 areas: evidence-based, data-driven, and team-based. Again, healthcare system is reforming. Okay, so we cannot say, okay, I'd like to stay in 20 years ago, I like that kind of practice. Okay, you can stay there, but the whole healthcare system is reforming. If you believe our mission to provide world-class, value-based healthcare with kindness, we invite you to Rendr's family of around 200 providers and more than 100 practice in 4 boroughs of New York City and Nassau County. And also as a Chinese, you will find your own belongings because you serve 98% of the patients is Chinese patients. Okay, so for more information or if you want to know a little bit more about Rendr, you can go to our website. You can go to our website or scan the bar. Okay. Any questions?
So that has a large Chinese physician group in the area. Do you offer any opportunities for the foreign medical graduates?
That's a very good question. We do sponsor some foreign workers, but the detail, I think we need to contact HR. We do have some people. Other questions?
So I'm a PCP. So for this data-driven method, I think it's good in one way, but on the other hand, so a lot of times those guidelines, of course, is not the best practice. Or so like let's say, for example, for tax media, the guidelines from age 21. So in order to meet the criteria, everybody above age 21 should go for tax media. meet the criteria 5 out of 5 if you want. But a lot of, especially for Chinese female, maybe they never had any sexual activity and there's low risk to catch HPV, which of course there's low risk to get cervical cancer. A lot of patients may or may not need cervical cancer screening because the guideline a few years ago was different, and now from maybe 21 is cut off. So what I'm trying to say is like such as lung cancer screening, of course there's a guideline, but is that the best guideline, or if we meet that criteria, does that mean we provide the best care? But if we achieve 5 out of 5 stars, that provides best care to meet the current guideline.
That's a very good question. I think, again, we use evidence-based practice, the guideline is from the evidence-based, okay? And data-driven, same as the same data-driven. Okay, so for example, the 21-year-old pap smear, honestly, it's very difficult to do it. A lot of Chinese young adult, female young adult, they just refuse. We try to explain to patients the importance of routine GYN care. Okay, if patient refuse or there's some special reason, we accept it. And also for the lung cancer, smoker, 50 years old, 50 to 77, for the long-term smoker, we need to do the low-dose CT. I do think this is a very good practice. As I initiate the screening, as I do more screening, I found out quite a few lung cancer and had the early approach to for the treatment. So I think that's a good practice.
Any other questions? All right, so you will always have opportunity to talk to Dr. Chen afterwards, all right? All right. Thank you.
Thank you.
All right, so in about 20 minutes, we're going to start our afternoon sessions. We're going to have 3 more very interesting talks. And for now, I think someone is enjoying the lunch, and you're encouraged to talk to the speaker. And we also have other physicians in this room. They didn't, come to the stage, but they are very experienced doctors. You're very welcome to talk to them, get their contact information, and I'm pretty sure they're going to be very, very helpful in your future career development. Yeah, so in 20 minutes, so we'll back here and we'll start our afternoon session.